Hello, this is Dr. Pranathi Gutta, Senior Pediatric Neurologist from Hyderabad. I shall be talking about rare diseases and why prevention of rare diseases is important and how to diagnose them and how to access the services in Hyderabad. A rare disease is a disease and almost 70% of these diseases present in childhood and 72% of these diseases are genetic in nature. More than 95% of these diseases are not treatable. At least 5% are treatable, and these constitute inborn errors of metabolism. It's very important that we screen for these as children or as the child is being born to prevent inborn errors of metabolism. They're also called metabolic disorders. These disorders are quite rare, and about 1,000 disorders are there, of which only 225 disorders are treatable. When we call what we call metabolic disorders, there are a lot of chemical reactions that happen in our body. So when one compound is converted to another compound, there's a chemical reaction converting that, and it utilizes a cofactor and an enzyme to convert one product to an end product. So any damage to the structure of this enzyme or the cofactor can lead to the accumulation of the predecessing substance or reduced end product. So this predisposition can cause these unwanted chemicals to get accumulated in the body, and they can get accumulated in various organs. Brain is one of the commonest organs. It can get accumulated in the heart, lung, kidneys, bones, joints, etc. So we start off with the three-generation family tree, wherein we recognize if any of the family members is affected by this disease and come to see if there's any specific pattern of inheritance. The three patterns of inheritance, one is autosomal recessive, autosomal dominant, and X-linked inheritance. So when we mean by autosomal dominant, one copy of faulty gene is enough to cause the disease. So if any of the family members have this disease, then it will come on to the next generation. When we come to an X-linked disease, girls have 2 X chromosomes and boys have 1 X chromosome. So usually what happens is when you have 2 X chromosomes, one of them is silent and the other takes over. Usually the faulty gene is silent. And for the male children, because they have only 1 X chromosome, they present with the disease. That is called X-linked disease. And when we come to the autosomal recessive condition, they need 2 faulty genes to manifest the disease. So if either of the parents has 1 faulty gene, they will not present with the disease. But this is typically seen in consanguineous marriages or marriages in relatives. So it's very important that we pick this up in the family history. Now coming to the antenatal, whenever we look at the child, what would have happened in the pregnancy is also very important. We do have certain clues to these rare diseases. And any history of delayed cry at birth or any problems during the neonatal period or when the baby is born is also very important. Any facial features or any clues to the diagnosis is very important. And suppose we don't have any clues to the inborn errors of metabolism, we directly go to the genetic test. There are 3 or 4 types of genetic tests that we do. So foremost is a karyotype, where we look at the different chromosomes. Then there are different other types of tests called whole exome sequencing, copy number variations or deletions, duplications, and MLPAs. Once the genetic condition is picked up or the inborn error of metabolism is picked up, if it is treatable, we are going to treat it. If it is non-treatable, then we will counsel the parents as to what is the inheritance pattern and what is the chance of giving it to the next child. It's very important to check for the different chemicals in the body. So we usually check for TMS, where we check for the acyl-carnitine profile and some of the amino acids in the blood. This is done on a blood spot, so you only need few drops of blood to do this test. Once we have a precise diagnosis, we institute the treatment either with extra vitamins, high-dose vitamins, or diet modification or special formulas. And these disorders need to be monitored carefully, like the way we monitor blood sugar. Prevention of these rare conditions. Since majority of them, almost 95% of them, do not have treatments, it's very important that we pick this up as soon as possible, if possible prior to the pregnancy. It's very important that parents planning for pregnancy seek a doctor's consultation even before planning the pregnancy, what we call it as preconceptional advice. For testing these chemicals, we need specialized labs. Particularly, we need a specialized technology, and the technicians and the scientists have to be quite experienced with these disorders, and the right methodology has to be used. And analyzing these disorders is also important. Once we get some abnormality, somebody needs to analyze this. So there are a few centers in Hyderabad like Yoda, where they do all the metabolic testing, including the TMS, GCMS, and plasma amino acids and other chemicals in the body. And also they also do the genetic testing, whole exome sequencing and copy number variations, and sometimes they do these as packages as well. So you need to speak to the team and find the best package what suits you.